हेल्थ इन्फो न्यूज के यूट्यूब चैनल को सब्सक्राइब कीजिए और हमारी हर आने वाली वीडियो के नोटिफिकेशन के लिए बेल आइकॉन प्रेस करना ना भूलें।
This is what's killing people. It's not just a virus. It's underprivilege. It's lack of access. It's years and years of living with health conditions that haven't been properly managed. Because of the colour of your skin, or because of your ethnicity, or because of your social group. I know men and women who deny themselves health care so they can save money for their children if they get sick. And they know if they spend that money on themselves, they will impoverish the family. This is still a deeply unfair, deeply inequitable world, in which access to the basic human right of health is something that is given by privilege and by how much money you have. We want to change that. We can't change it overnight. We're not knights in shining armour. But behind and underneath this pandemic, COVID-19 has caused devastation, but it's equally uncovered, ripped away the bandages from a really old wound that this society has. And that is our failure to deliver equitable healthcare, a failure to recognise health as a fundamental human right, and the fact that we leave people in difficult health circumstances, sometimes decades, forgotten in the communities in which they live in, refusing to deliver them basic healthcare. We need to build a more secure, safe environment for our kids and everyone else to live within. Health security is not an abstract concept. Health security is about fairness, it's about equity, and older people are paying an awful price in disease, in loneliness, in isolation, and so many other things. But there are others suffering in the same way.
हेल्थ इन्फो न्यूज के यूट्यूब चैनल को सब्सक्राइब कीजिए और हमारी हर आने वाली वीडियो के नोटिफिकेशन के लिए बेल आइकॉन प्रेस करना ना भूलें।